The first point we're going to look at is called wind gate. This is on the gallbladder meridian, and it's gallbladder 20. The reason it's called wind gate is because the Chinese believe that all viruses and colds are brought in by the wind. They're brought in through pathogenic factors, and they travel on the wind and they get into the body, especially at the back of the neck. So when it's windy, wearing your collar up like this often helps you to protect this area. This point is the primary point for pulling the virus out of the body. We're going to use some other points to strengthen the body and build the body up, to push it out and to protect the body, but this one is to open it, to draw it out. So the position that this point is in is at the back of the head, just below the occipital bone. So if you put your hands over your ears like you're protecting your ears, and your thumbs run right underneath the occipital bone, normally the thumbs will sit behind this muscle at the back of this SEM muscle, and that's the point. I don't want you to get too obsessed with the position of these points. In China, they'll be using acupuncture especially to kill off the virus and draw it out, but we can use acupressure. We just got to work a little bit harder when we're not using needles. And because we're using acupressure, you don't have to get exactly on the point. If we can get around the point, we have the same influence, and the influence is to really pull this out. This point has multiple other things that it also does. Is in core therapy, we know that it affects the muscles that curve the lumbar spine, so it works for lots of back pain, people that are suffering from back pain. Poor memory, because it's a strong stimulant to the kidney system. It increases blood flow into the head, so it can get rid of tinnitus. Headaches is a very, very big part of using this point. Once we get the blood and the lymph moving, then often we get tinnitus recovery. We can get stronger eye vision, more blood up to the eyes, more blood up to the senses around the head and stuff like that. So it's an extremely strong and powerful point. So what we do is we just close our ears, place the thumbs here, and then you're just going to run backwards and forwards right underneath the bone, and you'll probably find it's a little bit painful. Rub up and down, and like I was saying before, until your arms ache. So using the thumbs, if you can't use the thumbs, what we can do is we can use double finger pressure here. So just put one finger over the other and push up, stimulate, and rotate your head while you're doing this, because you can get deeper and further into the point. It's very, very safe. This is very, very often utilized point, especially when someone's suffering from flu, from colds, from fever, from coughs. It tends to pull it all out of the body.